Thank you, Doctor. That was lovely. I'd like to request Dr. Gk Prusty to please come up and give us a welcome address.
It's very customary that the organized team welcomes everybody. So, as a citizen of Kolkata, all the guests who have come from outside, sir, I convey my citizens' greetings to all of you and welcome you for this conference and to the city of joy. I welcome all of you for this Neurointensive 2014. It's customary that I must tell something about this conference and what is going. Now, the dignitaries on the dais, my friends, our guest faculty, and the press, both printing and the electronic media. Sir, I'll combine all the informations that I am going to convey during this conference and for you also to please print or advertise it for the sake of the medical science, for the development of medical science. Today we are holding a conference on neurointensive care. this neurointensive, we have intensive care, now we have neurointensive. Neurointensive is a specialty care which is evolving out of ICU. What is the need for evolving neurointensive? And what does this neurointensive does? Neurointensive or neurointensive care gives special focus for neurological diseases. Now in terms of talking about biology and I talk about evolution, in the development, what is the highest prize of evolution? The highest prize of evolution has been the human being. What you are, what I am, it is nothing but for the brain, the content of the brain. Now, it being the highest prize of the evolution and just 1/5 of the body weight, yet it gets most privileged one who gets the highest amount of energy. So 1/50 of the human body, the brain, consumes 20% of all energy, be it the oxygen, be it the blood, be it the glucose. So being privileged, it is also very amenable to get hurt very easily, because for everything it needs an optimum environment. So an insult to the brain does not end. It is a dynamic, a small insult to the brain or nervous system ripples, sets a ripple of activities. Now these activities leads to a secondary damage. Now the window between the primary damage, primary event and the secondary damage is very short. So one has to map this window so that before a irreversible damage has occurred to this brain or the nervous tissue, we must identify, we must anticipate that this is going to happen, we must recognize it, then we will try to prevent it or treat it. This is where the role of the neurointensivist comes. Why we are talking with the neurointensivist or neurointensivist? Because they are more aware of these problems, so they have the ability with the facilities in neurointensive care, they can pick up these symptoms or signs fast and then act to prevent the further damage. Now this, as I told, neurointensive is evolving, then where was it? To start with, the neurocritical care or neurointensive was only to take care of the post-operative neurosurgical patients. Then we added to it to take care of the head injury patients, traumatic brain injury and spinal injury patients. Then we take care of the brain hemorrhages. Now in the recent years, the branch has evolved so much, the technology because the computer, advancement in the computer, the monitoring facilities, the physiological monitoring that we are having, it has now taken with the neurocritical care, the multiple neurological problems are as neurosurgical problems. What are these neurological problems and neurosurgical problems that we take care? In neurosurgical problems, all these patients having brain hemorrhage, particularly subarachnoid hemorrhage, vasospasm, coming to neurological problems, patients having stroke, patients having paralysis due to Guillain-Barré syndrome, and patients having severe seizure. The two most aspects who have been benefited by these neurointensive care facilities are the traumatic brain injury patients as well as patients with stroke. These patients who are having the primary or secondary neurological problems, they do not have only neurological problems. They are also having added to this complexity of other general problems. Problems arising because of the neurological problem, they can have heart failure, they can have a pulmonary problem, respiratory problem, they can have liver problems. So in a neurocritical facility, basically the facility besides the monitoring facilities, you have the team of doctors which consists of the physicians, the intensivists, the neurosurgeons, the neurologists, the anesthesiologists, the physiotherapy group, the rehabilitation group, the nursing group. So they are geared to find out the symptoms very early so that you can prevent the damages that can occur to the patients. Now what is our problem? Our main problem, we do not have enough manpower who are trained or who are educated in this branch, so can they handle these patients. So as I said, it is an evolving branch which is now going to reach its maturity over years. With these facilities, we have now proved that patients with stroke with good care, if they are brought to the hospital within 4 hours, you give them, do a thrombolysis, the results are 5 times better than what used to happen today, earlier. With the group, with the team activity, with the team care, patients with stroke, these patient results, the improvement have improved 3 to 5 fold. Similarly, in traumatic brain injury patients, the improvement has occurred almost the good improvement in the recovery cases. it has improved from 40% to 80% because of the facilities. Give another example, in the brain hemorrhage, the mortality rate has come down by 4 to 5% because of the intensive care facilities. So friends, it is not that because intensive care is there, it's given because of team activity, we are identifying the problem, we are preventing a secondary damage, that's why this is happening. So with this background, it is time that we should have a public awareness, we should have more and more people educated in this to monitor these patients, particularly the neurointensive care, so that we can have the greater manpower and better facilities which we can extend to our society. Today, with the development, with the industrialization, more and more people are amenable to neurological diseases, particularly seizures and trauma, stroke. And unfortunately, these diseases are the disease of the younger age group, from 15 to 45. The best period of life, this is the time when the people suffer from these diseases. So one of our aim is educated people so that we have enough manpower, our doctors are aware of this problem so that we can serve to the society in a better way. I would like to tell you here, the KOLKATA Medical Research Institute in the eastern part of India is the first institute to have this awareness, and we started the neurointensive care long ago in this institute. We are the first people who could think it and do it. My seniors, Professor Indra, he was in the cornerstone, and this is a heritage institute which started way back in 1967-68 to give neurosurgical care in this neurological and neurosurgical care in this part of the country. Friends, with these words, I will request our media, printing media, please spread our messages to everybody so that people know that with the neurointensive care, the results of neurological care become better. Thank you very much. I welcome you all again, once again, and wish you a happy conferencing. Thank you very much.
Thank you, sir. I'd like to request Dr. Arvind Mukherjee, Senior Consultant Neurologist, to come and share a few words with us.
Good afternoon. Dignitaries on the dais, Professor Ramakrishnan, Professor Radhakrishnan, our valued guest, Dr. Bora, Dr. S.K. Singh, and my very close friend, Dr. Gk Prusty, and my colleagues in the audience. First, I was rather honored to be here among these very honored guests, and this neurocritical care, as we can remember that when we are students, this neurocritical care concept was not existing. When I worked in the PG hospital, the first critical care units were set up, but they were under the control of the anesthesiologist, and that continued for over a decade. Only for about less than a decade or so, the specialty of neurocritical care has evolved, and now it is one of the most rapidly growing discipline. And I think this is one of the wonders in the neurological science, and that has saved many lives, because this neurocritical care concept is a joint concept. There should be an intensivist and there will be other colleagues who work together to give the best results. I am very happy to be associated with CMRI for last more than 20 years and getting all the facilities of neurocritical care, which is growing day by day, and we have now a large number of critical care beds, and we are offering state-of-the-art treatment facilities to all our patients. I really congratulate Dr. Prusty for organizing this very important and very well-planned conference for today's afternoon and tomorrow's half-day conference, where the threadbare discussions on different aspects of critical care, neurology will be, and neurosurgery will be discussed. And I think at the end of it, we will have a good amount of take-home message from this conference. I wish this conference a very successful one. Thank you.
Thank you, Dr. Mukherjee, for enlightening us. Now I would like to request Mr. Suez Bora, the Chief Executive Officer, CMRI Hospital, to speak a few words.
Dignitaries on and off the dais, some of my colleagues who are here, ladies and gentlemen, and friends from the media. We at CMRI are bound by the values of CK Birla Group, which has continuously raised the standard of medical care in this part of the country. Our neuroscience department has continuously done very well. Rather, it was one of the first neurointensive critical care unit of its kind in Eastern India. Since then, they have been doing good things, innovative things. We have got one of the best doctors in today's conference. A few of the good names in this neurosciences have come from all over India, including some of the speakers are from our own neuro department. I'm sure there will be a good learning experience for the persons who are here. I wish this conference all the very best. Thank you.
Thank you, Mr. Bora. Now, may I request our group CEO, Dr. S.P. Singh, to throw some light on this occasion.
I think this is a wonderful afternoon, wherein we are organizing this neurointensive program for 1.5 weeks. As Dr. Prusty and Dr. Arvinda Mukherjee said, neurointensive subspecialty which is getting developed or getting mature as a science in this part of the country. And we were pioneers